1 in 8 couples in the UK are struggling with their fertility, meaning struggling to have babies. Millions and millions of pounds are being spent in the UK, obviously US and every other country, on fertility treatment. And yet there's something called, I forget the saying now, it's missing the bleeding obvious. And the obvious we're going to talk about today is nutrition. You're watching the Natural Medicine Podcast with myself, Haroon Rabbani, and with Dr. Ashish. Welcome back, Ashish. It's good to see you.
Thank you.
I'm giving you a chance to speak here. So talk to us about nutrition. Why do people not talk about nutrition in the who are trying to get fertile? Is it important? Obviously, it's important enough for us to do an episode here, but how important is nutrition to people getting improving their fertility rates, improving their pregnancy rates, and so on?
Yeah. Hi, Harun. It's wonderful to be here on another podcast, and of course, my favorite topic, talking about fertility. But you and I know, as practitioners and even as people who follow the path of natural medicine and living holistically, you are made of your foods. What you eat, that is what makes you or breaks you as well, if you're not eating it correctly. Yeah. And it's no different for fertility. It's no different for when we talk about the egg quality or the quality of the sperms. Because when I talk about fertility, now that I'm doing a lot of lives on TikTok and having a lot of interaction with women, everybody's talking about, okay, how to improve my AMH. AMH is anti-Mullerian hormone, which is to do with the quality and number of eggs. The more eggs you are releasing, the more AMH there will be. And it's a marker for fertility. So when AMH is lower, that means you don't have enough eggs or the quality of the eggs. Now, when women are asking me about AMH, they are asking me for a pill. They are asking me even for a herbal pill. Even if it is natural, for them it is a herbal pill. Yeah. Whereas your AMH, two main things that work for it, or for fertility overall, for men and women equally. One is your diet. Foods that you're eating. And I'll tell you what other things around. We're going to talk about that as well, not just only what you're eating. And the second is breathing. My favorite topic. We have done breathwork podcast, remember? Last week. So those two things.
So breathing and the diet, the nutrition. Okay, so
and breathing is nutrition as well, right?
Yeah, it is absolutely. It's totally interrelated. So, okay, so why do you feel, because people are still eating food, why do you feel fertility rates are declining?
Oh, lots of factors, multifactorial, like any other issue. But 2-3 key things that we know of why fertility is declining for both men and women. One is because of oral contraceptive pill. The oral contraceptive pill was introduced in around early 60s. Since then, the using of oral contraceptive pill is not just only affecting women, but it is affecting men by being it in the water supply and in the food chain. Yeah. So the babies that are being born, now that we are seeing generational studies for last 70 years, 80 years, is that it is causing a disruption in how the testes are being developed. Yeah, because we're using a lot of oral contraceptive pill, and it is then leaching out into the system. It is going to leach out through the urine for women who are taking it. Secondly, all the hormone disruptors, the chemicals that we are using in and around our homes and on the bodies of women in the form of makeup and skincare, that is also causing a lot of issue to do with hormones. Yeah. So those two are I think, the modern day phenomenon. And of course, there are environmental toxins as well. I know you talk a lot about toxins, right? The air that we are breathing in, the water that we are drinking, and the air in our houses, for example.
Yeah, absolutely. And at this time of our human era, particularly in the UK, for example, with fuel bills rising, a lot of people aren't using their heating system. One thing they're going to have is mold on their windows and various places in the house, and that is hugely toxic to them as well. So the toxic buildup
Yeah,
and basically oral pills and wow, it's a lot. It's a lot to deal with
yeah.
for anybody, let alone someone who's trying to get pregnant. So there's there's a lot of good advice, so-called good advice, given by I don't know the public health authorities about what food you should eat. Five fruits and vegetables a day. Why isn't that working?
Really good question. You know, and I know why it is not working, because people are not taking that advice seriously.
Mm,
Um, one thing that I will highlight here: any food which is nutritionally has got all the goodness in it. For example, say avocados, brilliant food, right? Has all the right protein in it, has all the right fat in it. It's a fantastic food for fertility. However, how much you should be eating, in what quantity, in what combination, what time of the day, depends on, again, on your body constitution, on your personality type, how much your body can digest without piling, because it is a quite rich fruit and food as well. So you
mm,
don't want to pile on weight also with that, or be aware that you might be becoming overweight with having too many avocados, because it is quite rich food.
mm.
So that is what is missing in modern nutrition. However, now we see people like you have done functional medicine, right? So there are practitioners who are doing functional medicine nutrition. So they are taking into account that people are subjective. So not every food is suitable for everybody. But
Mm.
the key thing that they're missing, the wisdom that they don't have, is the body typing, which Ayurveda talks about: personality type, your body type, which makes it so unique. It could be the same food, but two different people will can be eating it completely different way.
Wow. So let's just confuse people even further. But we're not going to do that. Where we've actually, for those of you who are wondering body type, we'll touch upon it a bit more in a second. But we did an entire episode on this. So make sure you scroll on the playlist or our channel, and you will find the one we did on body constitution or body type, also known as doshas. So just a quick overview of the three body types, please, so that people understand, and then maybe correlate it with what kind of foods they should be aiming for. At the moment, it's general advice. So, can you do
Yeah,
that?
yeah, definitely. So we have Vata, Pitta, Kapha, three types mainly, and a combination of the two. We always have a combination of what we call doshas, but it's the predominant one which always rules your body and how your system works. So dosha is, because it's cold and dry, you want moist and warm foods. Pitta is warm or hot and moist, so you want cold, not very dry foods, but you want cooler foods. By cool, I don't mean foods in the refrigerator. Cooler means which are cooler at room temperature. Yeah. And then kapha is, because it is cold and moist, you want something dry and warming kind of food. So that is very quick overview. Otherwise, we did the whole episode. Even that wasn't enough.
Yeah, absolutely. So make sure you find out your body type, your dosha, and there'll be a link below. And also watch the entire episode because it's actually absolutely phenomenal. So, is there a particular type of nutrition, just an overview, that people should be looking at if someone's trying to get pregnant? Obviously, we're at the moment we're talking about women. We'll go on to men in a minute, but the women, is there a particular type of diet they should be on and nutritional plan they should be on?
Yeah, it is really, really confusing. We do not have a lot of data on it. Some initial studies are showing that diet, which is more like Mediterranean diet, mainly fruit and veg, some good quality virgin oils like olive oil, and then some fish in your diet and little lean meat,
Mm,
like once a week or something. Uh, that is a really balanced, wholesome way of eating food, a lot of fiber as well, which will come from fresh fruit and vegetables. So studies are showing that those people, when they have done retrospective, means when they have looked at women who did get pregnant faster, with or without IVF, what were they eating? And when they saw what they were eating was Mediterranean kind of diet, uh, they conceived much faster, right?
mm,
So that is the trend that we are seeing in terms of what the studies that we have. But I have my hunch, and it's a good hunch, that if we use natural medicine principles, if we use Ayurvedic principles, which go even further back, and goes really in depth into your health and well-being, we have we have the real food, real nutrition, which will work for everyone. Yeah.
Right.
And yes, we are talking about men and women equally. There are few little changes for men, but mainly diet would be the same.
Right. Okay. So I think we need to do an entire episode on the Ayurvedic diet by the sounds of it as well, because I think it's very important. What are the key principles about Ayurvedic diet? You mentioned, and this is not advice, just key principles. And by the way, if you're watching this and you haven't watched this before, we are sharing with you information for education purposes. And if you want to make any change, particularly in relation to medication, then go and speak to your doctor or have a consultation. And if it's Ayurvedic medicine you want to be dealing with, then obviously Dr. Ashish, make sure you, that's her, by the way, another person on this video. So make
Yeah.
sure you consult her. This is not, none of this, what we're doing is medical advice. So can you share the kind of foods people will be looking at in Ayurvedic diet compared to, say, Mediterranean diet?
There are a few foods which are specific to, for example, Indian subcontinent.
Hmm.
One big difference is that in India we use a lot of ghee in cooking, which is one big difference from Mediterranean diet. And also we use a lot of lentils, much more I think than Mediterranean way. And there are more. I think there are more recipes of vegetarian foods in
Hmm.
India or Indian subcontinent, India and Pakistan. But that's the key difference, I think, in terms of when we talk about Mediterranean diet. And of course, India has a huge coastline, which means a lot of those people who are around that coastline, they do already eat fish as part of their healthy diet. But we are talking about oily fish and not necessarily fried fish. This is about shallow baking or shallow frying fish, which is how it helps, and of course the oil that you're using. So those are the key differences. But Mediterranean and India it has quite similar things, because even in Mediterranean countries they are using a lot of lentils, right? But it is the way that we cook in India, it's different. So because there is a lot of sauteing that goes on with the onions and with the spices, and that I find is what makes the key difference.
Wow. Okay. So for anyone, this is quite interesting because a lot of people, there are people out there. Can you believe there's actually people out there in the world who don't like spicy food. But what they mean by they don't like spicy food is they don't like the chili. So just don't put chili in. It's as simple. Sometimes I make spicy food because other people can't eat it. It doesn't have to be bland. So Ayurvedic, basically, in essence, Ayurvedic food is very tasty. There you go. So in terms of we've been really talking about, anyway, the perception will be about the fertility of the woman.
Yeah.
What about the man? Because without going into that, I know of a couple, for example, one of them was close to me, female, she couldn't get pregnant,
Mm.
and their family, like her in-laws were doctors and so on, and they're automatically blaming her. Oh, she can't have babies, but actually it was him. And that's not really talked about. What's happened with the fertility rate of men?
Oh, I am pretty sure you're aware, but fertility rate of men has declined since 1970. There was a big study that was done, I think, about 5 or 6 years ago, or maybe even 10 years ago, which has shown that rates have gone down almost 50%, and it is still going down. It hasn't stopped yet. Yeah. So men's fertility, one reason that the quality of the sperm is not good. And the second thing is that the size of the testicles is reducing. Like I mentioned earlier as well, the size has been reducing since 1970s, to do with everything to do with men's lifestyle. Smoking, drinking, sitting down in a desk job, and central adiposity, as we know what happens with pre-diabetic condition. All of those factors don't help. And that is when, their fertility is going down. They are not, I think it's even a bigger taboo for them to talk about fertility issues and sperm issues. And in certain cultures, it's almost always assumed that he's fine. Also,
Yeah.
if he can sexually somehow perform, it is assumed that his sperms are doing fine, which is not the case. You can sexually be doing marvelous, but may not have good sperms.
Right, right. And that's, it's so important to understand this because the burden is placed on the female, and actually a lot of it's really, it's almost like an identity issue,
Yeah.
for, I'm talking about heterosexual men. Basically, if they're firing blanks, it's something they just don't want to talk about, and certainly won't admit it to anybody so quickly. So if you're a man with that issue, it's so important you talk to an expert. And it's also, the good news is that you can do something about it. We'll be talking about that shortly. So first of all, let's talk about a very popular question, and we're aiming all the questions and the answers from you today because that is your special expertise, is fertility. So
So you
um,
don't get to speak today.
no, I don't get to speak except our question, ask question, which is absolutely fine by me because I'm fascinated. So a very common question I know you get is, what herbs can you take?
Oh my gosh. It
So,
is. It is. Give me the names of the herbs that I can take. What herbs can I take?
right.
Um, so my bottom line answer to everybody in that scenario is, if you're looking for name of a herb, go to a practitioner who can prescribe you herbal medicine in whatever shape or form that may be, maybe like a pill, capsule, or a tincture or a herbal tea. Do not, only because you can buy them over the counter doesn't mean you know how to effectively use them. Yeah, most of the herbs that people are buying over the counter or from health food shop, they are really, there is hardly any herb in it. Right, even in herbal teas is just the gunk of the whole dried herb that is being used in all these teas that we see commonly.
Mm.
What was the question?
So the question is, what herbs,
Herbs,
what
yes.
herbs can people use to
So
increase their
I normally
fertility?
say, herbs. So you can use any herb effectively, depending on what the issue is. So if the issue is about egg quality or the sperm quality, then within that, what is the issue? That we know after we have done a consultation with you. Is it a gut issue because of which you are not digesting properly, proper nutrition, or is it a mind issue that you are worrying and constantly again not digesting but coming from a different place? So we need to first know what is the issue and then give herb accordingly. So even a simple herb, say for example chamomile, right, very very common herb, easily taken. If you have a gut which is tied up with your mind, you think and your gut starts to play up straight away, chamomile will work really well. Is it a fertility herb? It's not, but can it help you on your fertility journey? Greatly, right?
Right, right. Okay. That's phenomenal. That's absolutely phenomenal. So in essence, what you're saying is chamomile is a relaxant. It helps you relax. It helps you
Yeah.
calm your mind down. And if your mind is relaxed, then your body will be relaxed and your digestive system will do its job properly. So
Yeah.
what does the, I mean, I think kind of given the answer to that, but what does the role of the mind play in fertility and digestion in this case?
I think for mind, we need to explore that a lot. I was listening to another practitioner, while scrolling on Instagram, and she was talking about that all the studies that we do or have done, most of the studies, they are done on, um, when we talk about randomized control trial about something, most of the studies are done on men. Okay, so we do not have a female perspective, because if a study has been done, for example, you're studying mind or you're studying how the mind is behaving in men, it should be equally done in women, but that's not the case. Yeah. We are presuming that the same medication, for example, how it affects men is going to affect women, is not correct, because women have far more hormones to play with.
That's mind-blowing, excuse the pun. I mean, so wow. So if it's all done in men and we're blatantly different hormonally, that's
Yeah.
absolutely crazy. So
So to answer your question, mind is as we know, every disease is psychosomatic. It comes from the mind. Actually, your favorite person, Gabo, I was listening to
Much,
him.
yeah,
Yes,
yeah,
I was listening to him yesterday, and he said every chronic condition is coming from your mind.
yeah.
How you, the stress that your mind is perceiving, that
Mhm.
is setting off this chain, which later on will manifest as a disease, right? So no different for fertility either, where your fertility, it works. I have seen it working where patients are positive, and I'm not talking about faking positivism. It is about people who genuinely are solution providers. They're looking at solution. They're go-getters. They just want to get on with it and do it. And then there are those who are just constantly worrying, and then what you find is there is a problem at every step, because that's what their mind is looking for. So mind has a huge role for men and women equally. We know that something is on the mind and you can't get an erection, or you can't, get an
Right.
intimacy how you.
Yeah. So it's, I don't think we can emphasize it enough, because if you are stressed, and chronic stress is on the rise, like massively on the rise, if you're chronically stressed, then not only are you going to damage the performance of your intimacy, but also you're going to be depleting yourself of crucial nutrients from your body. So you're actually destroying nutrients in your body. Um, if you got gestational diabetes, for
Yeah,
example, you're gonna get blood sugar spikes. So you're gonna make the diabetes worse. And if you're stressing and you're not sleeping, then what's going to happen is that's also going to affect. It's a vicious circle. It'll mean that your
indeed.
sleep will cause more stress, which will then affect your physical body and so on. So
Yeah.
so
And
yeah,
also, have you ever wondered, Harun, that your all your hormones are released by precursor hormones, and all the precursor hormones are released here in the head,
yeah,
in your brain. So your hormonal balance actually is coming from how your mind is perceiving things, how you are doing mentally and psychologically. And that is something which is, I don't think it's explored enough.
yeah.
Neuroscience is exploring, but we are not just only talking about the neuroscience, we're also talking about the perceptibility. What Bruce Lipton talks about, how you perceive things. If the stress may not be enough, but if you are perceiving it to be huge stress, you're going to get stressed with that, and that is going to set a chain of events. Further down the line, your ovaries are affected and your gonads are affected, and everything else. I think that we miss that point so much, because I don't see that discussion anywhere, that we need to get this in the right place, in terms of fertility specifically.
I think, I mean, just based on what you're saying, is that if you're looking to get pregnant, you need to take ownership of what's going on in your mind. And yes, stress happens, shit happens in life. It does. It happens all the time. And it's how you perceive the world, it's how you receive the world, and how you transmit onto the world your perceptions. So in essence, when you're receiving the world or perceiving the world that everything's going awry, everything's going mad and out of control, then you're also transmitting to the rest of your body
Yeah.
the madness and the chaos, which is not helping you. So, first thing I would say is, again, there's an episode on breathing we did, I believe it was last
You
week.
got it.
That's the first thing.
Yeah.
First thing. So as a summary, Ashish, how does breathing, and what kind of breathing exercise will be most useful for a woman trying to conceive?
Yeah, I think there are different stages of it. So when you are trying to conceive, what you want is intense form of breath work, because you're trying to bring in a lot of oxygen. With oxygen, you bring in a lot of, when oxygen is in the blood flow, you also bringing a lot of nutrition to the cells and to the eggs and sperms as well. But when you are pregnant, or if you're going through IVF at the time when you have embryo transfer, you want to do very gentle breath work. So depending on where you are, when you don't want to put a lot of strain on your abdomen or on your body, you do very, very gentle, slow breathing. But otherwise, when you're trying actively and you're still in that early phase, then intense breath work like Kapalbhati works really. I mean, I recommend it. I teach my clients and patients. It's a wonderful pranayam, and it's so wholesome, you know. As you know, one of my patients has lost 10 kilos just mainly, and she attributes it to the pranayam, to the breathing exercises that she has been doing. She has been taking herbs and everything else also, but she says that is one thing that she was doing actively. So, and I know that Kapalbhati, because it works so intensely on your abdominal muscles, good for insulin resistance, by the way.
Oh, for sure, for sure. One of my clients, his heart rate was well. This is not Kapalabhati. This is a different type of breathing technique. It's still another pranayama, which is, by the way, a name for breathing exercise. His heart rate was about 100 and like active heart rate was about 145. When I say active, moving around the house. His
Yeah,
resting heart rate was about 115 to 125. And over a matter of weeks, he brought it down to 73. And it's about 70 at the moment. This is the active heart rate. So it makes the world of difference. And we also measured his stress levels and how it's affecting his organs and his psychology. All of that shifted
yeah,
simply because of the breathing. That was actually the main reason. So one of the things that I do strongly recommend is once you got the breathing a bit more quality controlled, let's put it that way, once you're doing the breathing exercises, that's also a good time to move on to meditations.
yeah,
Um, my preference is guided meditation, meaning get a teacher, a guide who knows how to lead meditations. And the reason is that a lot of people do meditations and all they're doing is they're sitting up, in essence, they're asleep. They're not actually
yeah,
meditating.
yeah,
The idea of meditation isn't relax so much that you sleep, nor is it to have an empty head, but it's actually to create space
yeah,
between the thoughts, to create that. And even, some of the most experienced meditators, Zen Buddhist monks, they don't get empty heads very often. So it's not about that. So there's a lot of misconception about that. So
yeah.
just doing, I mean, I know you have different prescribed different way to do it. My thing is, you know what, if you brush your teeth twice a day, then you got to also meditate twice a day.
Mm.
It's If you don't brush your teeth, you're going to have a foul smelling mouth, breath, and your teeth will rot. You're probably much worse is going to happen. Meditation is probably one of the big, big medications, but it's natural. It's absolutely natural.
Yeah,
People don't want to do it because they think that other things in their life are more important. But if you're trying to change your life, you're trying to conceive, if you can get to that stage where you can get guided meditation, really simple. And yes, there's good apps out there, etc. My preference is when you start with a guide because you can
yeah,
spend months and months doing it incorrectly, even on an app. So definitely get yourself a good meditation teacher. Both Ashish and I do that with our clients.
yeah.
Not just that, but that's a part of our program. So that's very important. Is there, when it comes to fertility and ovulation, is there any kind of nutrition people can take, women obviously, can to boost their ovulation?
Yes, one of the main, actually, two main things. One is the good quality fat. So it is, I do recommend to eat a lot of ghee, and we do have medicated or just simple plain ghee as well. And ghee is, saturated, ghee, not saturated, what is it called?
It's a
Oh,
it's a butter. It's something, but it's Indian butter. That's all you need to know. But it hasn't. It's got had the lactose removed, so you don't have if you're lactose intolerant, it's not a problem. So,
yeah.
um, so
So
go.
ghee is fat that you can have, but it is the way it is made. It is highly good for your gut, and also the way it carries nutrition to your body is amazing. And it is one of the big parts of my recommendations for people to eat. Or if you're using oils, if you are vegan, you don't want to eat ghee, then you need to use virgin oils of any kind, nut oils or other oils, whatever you are, you can get your hand on. The other thing is antioxidant rich foods. And berries, as we know, are highly, highly rich in antioxidants. So,
Mm.
any fresh berries, you don't have to buy any expensive, extra expensive berries, but strawberries, raspberries, blackberries, blueberries, any kind of berries that you can find fresh or even dried, get those and use those. Obviously, not the one with sugar. But yeah, those two are the key factors. What I find, what I've seen in my practice, which improves the quality and the number of eggs.
Beautiful. And the thing is with berries, especially if you live most parts of the world, so here in the UK, they grow so easily and naturally.
Yeah,
And this is my allotment and farming side coming in, which is grow the things yourself. It's so easy. Put them in your garden if you have a garden. If you don't have a garden, then put them in a planter
put them
in
in a
your
pot.
house. And I tell you what, we've got such an abundance of berries. Blackberries you'll find if you go out in a country park or something or countryside. They're everywhere for free. Stick them in the freezer like we've done because we've had so much we've had to freeze them up. So that's definitely useful. So would that also help men to increase their sperm count as well?
It does. So fat is what, as you know, we make cholesterol from fat and we make hormones from cholesterol. So that is the chain of events that need to happen. So rather than taking essential fatty acids in any synthetic form, it's better to eat the food and to actually enjoy the foods as well. So for men also it works. In addition, you can take magnesium rich foods and zinc rich foods, like banana is one of them that you can take as long as weight is not an issue. If weight is an issue, then you need to make sure that you are exercising enough to eating any rich foods that you are taking. So that is the little different in men to improve the quality, but the quality and the number and the motility improves with the fat. It's the quality of the fat that is required.
And for men, if you just think your little swimmers, they've got a lot of energy, right? Running, swimming around, getting to their destination. Well, check your own health. Are you someone who's able to not literally swim around but move around? If you're slow, lethargic because you're overweight, then you not may you will have to do some work on your physical health. So do pay attention to that. So is there a particular time, because we know that so many people are on really terrible diets, terrible nutrition. When I say diet, by the way, I mean nutrition. I don't mean taking 7-day dietary plan or
Yeah.
21 day. Is there a particular time when someone should take nutrition, the kind of nutrition we're discussing, or yeah, I mean, when they're trying to conceive, is it just as they're trying to conceive? Is it a month before? How long before?
About 3 months, because that is the time that we require for eggs to turn around and for sperms to turn around. So 3 months is a good window, but those 3 months have to be consistent 3 months. If there is no lapse, there are no takeaways, there are no, it's not 80-20 that you do 80% of the time and rest 20% you do something else. You can't do that. So it is every day you have to be consistently doing it. Yeah. And so 3 months is what I recommend at least. And then it also depends if, alongside, if you're working with the practitioner, they can check how your gut is working. Are you digesting? Are you constipated or not? And accordingly, you know whether you are actually able to absorb that nutrition or not.
So keep in mind that some of you who are watching, you may be older. So say a young couple, if they're trying to conceive, of course, they've got an opportunity now. Is there a particular age when fertility actually declines?
Yes, we hear a lot about women's fertility. After 35, it reduces. Your fertility is reducing every day. From the moment you're born, it is reducing. The best window that we have for women is between 25 and 35. Yeah. After 35, it drastically reduces. It drastically reduces in Asian women, South Asian women, even more drastically. So for men, they also have aging, but their age limit is much more extended, you know.
Right.
And because we're only looking at one sperm, Most of the men, if not themselves, then there is ICSI and other procedures with which we can at least get one sperm out of them. So that is
Right.
why their aging is not that, I would say, that crucial. However, we know that aging or the quality of the sperm is a big factor in miscarriaging. Okay. So even if when you think, okay, it's all fine, health is all fine, or as they say, most patients say, it's all fine. And I say, define the fine for me. What do you mean by fine? But if it is, if the quality of sperm is suboptimal, as we call, it is not up to the level, then it can cause miscarriage. And there are studies, evidence to show that.
Wow. So that's actually that. This is new to me because I've not looked at those studies. So in essence, you might be fine in your mind, but
Yeah.
then the quality of sperm is bad, and then that will lead to miscarriages potentially.
Yeah.
Wow. That's like taken me aback. Wow. That's actually a biggie. So so your age matters a lot. So if a lady is in her 40s, early 40s,
Yeah.
can she conceive without IVF? Can she conceive naturally, in other words?
She can. She can. Absolutely. As long as you have menstrual cycle and you are ovulating, there are chances to conceive. Chances keep reducing every single day. Uh,
Right.
However, still up to 45, there are chances for you to conceive naturally, or even with IVF, chances are that you can conceive very quickly. Yeah. Even with the reduced chances, there is still good chance for you to get pregnant.
So I've got a couple more questions I want to ask.
Yeah.
It's absolutely fascinating. First of all, it is your specialty. For anyone who I presume they can be international, but primarily UK based, if you see them personally, how do they get hold of you? What's the first step they do if they are looking to get pregnant and they're having trouble getting pregnant? What do they do to contact you?
Ashish Veda, online. You can find me on Facebook, Instagram, TikTok, LinkedIn, Twitter as well. I don't use Twitter as much, but I'm more actively using Facebook and TikTok and Instagram. I do have a Facebook group which is called Fertility Coaching by Dr. Ashish. So people can join that, learn, educate themselves in their own time, especially when you have just started to get into this whole fertility journey thing. Yeah, ashishveda.uk is my website. So they can go on the website, and again, all those links will be there for them to explore.
Fabulous. So we'll put the link in the description. So the thing is, I've seen, I know certainly if one family member, my sister actually, she had to have three IVF treatments. This is like 25, 26 years ago. In
Wow.
fact, more than that before she got pregnant with her son. And A, it's got very costly for them. B, she looked each time she had a treatment for the longest time, she looked like a zombie. She was like it was really, really horrible for her. So she went through hell and back. Had she known, or had we known, I wasn't involved in making their decisions. It was their decision to make. Had we known, or had they known, then that there are natural pathways, then they probably would have come running to you. So
Yeah.
make sure if you are somebody who's trying to get pregnant, make sure you get hold of Dr. Ashish. Otherwise, if you've got a family member, get them to get in touch. And you get to that space. For most people who get to the space of they're trying to get pregnant but they're struggling, it didn't happen overnight. It would have happened over a lifetime. Like you just mentioned,
Yeah.
fertility rate starts dropping. Obviously, children aren't fertile, but from a very young age, they start dropping whenever they're fertile. It starts dropping day by day. So, and lifestyle choices,
Yes.
big, massive. Nutrition, massive. Exercise, all of these took a long time to get there. So, the mad thing that people ask for is give me a pill to get pregnant, give me a pill to stop getting pregnant. Yeah, there are pills out there that can damage your bodies, and that's the intention,
Yeah.
oral contraceptive, right? um, Whereas trying to get to natural health, there's
No.
not much money in it. Everyone wants to pop a pill, But actually, you know what? You need to change your lifestyle. So if you are looking to get pregnant naturally, then expect it to take a few months. Number one, expect that there's going to be significant changes because people who are looking to change their health condition, like I deal with diabetes, of course, um, they struggle. It's not because it's a struggle, it's because it's a psychological thing. You need to be held to account and challenged and supported and also doing the right thing. So, my final question to yourself, Ashish, is are there any particular food types that people should avoid like the plague if they are trying to get pregnant?
Oh, the usual ones, as you know and I know. So all the sugary foods, sugar should be out of your system, if possible, completely. I understand people who have, sweet tooth and they can't take sugar out. Then compensating it with some kind of healthy sugar or healthy fruit or food that give you similar kind of taste. However, for 3 months, if you can restrict without sugar, that would really do you good in terms of the quality of the sperms and the eggs. Rest is processed food of any kind, because processed foods or canned foods, they have a lot of salt and sugar in them, hidden salt and sugar. Barbecued foods, nobody should be eating as much barbecued food because you get the burnt food, which is not good for your cellular function. It doesn't help.
Well, it's carcinogenic, it's cancer
Yeah,
causing.
exactly, exactly. Microwaved food. So I ask people to chuck their microwaves out if they are eating any microwave food or any convenience store takeaway food. Um, and what else can they not eat? I think those are the main ones.
The key thing to do is just think any in my mind it's actually quite simple in the context of any food that's in a container and it has got a list of ingredients. So a container might be a piece of packaged paper or something. It's got a list of ingredients. That's processed food. Get
Yeah,
off them. You do not need it. And why do they have so much preservatives? Because if they were left to nature, they will rot. And you mentioned earlier on about chamomile, for example.
yeah.
So we pick our own chamomile in the fields here where I live. And massive difference between the taste of fresh chamomile or
Oh,
dry
absolutely.
and the one you get from the shops. Absolutely massive. We know for sure that if you're drying these foods, if you don't dehydrate them enough, and it takes a long time, if you don't dehydrate them enough, then they will get moldy. That's the
Yeah,
first thing. Second thing is if you're rushing it to dehydrate them, this is I'm talking about the stuff you buy, then you're going to have to raise the temperature above 44 degrees Celsius or 45 degrees Celsius. You're destroying a lot of the nutrients in
yeah,
there as well. And so I know it's a catch 22 situation, but what I'm saying is that processing of any kind of any sort can damage a lot of the foods that are in there. So, go as natural as possible. Get off the processed foods, stop the sugar, you don't need it. And just to add more bit of misery to the whole thing, most of the time we're craving sugar.
yeah.
It's not you, it's the fungus, the yeast, and the molds within your digestive system and even on your skin, actually, which thrives on sugar. As a result, what they do is, in order for them to breathe, and breed, they will send chemical signals which go to your brain. Hey, I'm hungry. Feed me sugar.
Yeah.
You're not feeding yourself, you're feeding those guys.
Also, I just want to mention here salt. Actually, I was reading one of the studies which has looked at salt and the inflammation. And I know that from Ayurvedic point of view and also from Tantric point of view, if you're trying to cleanse your uterus or any inflammation to do with your period, you restrict salt. And I've experimented with this with myself and with patients as well, where you're restricting salt intake at least for those 5 days or even longer. And your pain will reduce, your flow gets better. So salt is also it's a pittagenic food. Yeah, it creates pitta, it creates heat in your body. So from that point of view, excessive amount of salt. And as you know, processed foods have hidden salt.
Yep. Yeah. Well, it's because they're so disgusting tasting that without the salt, or without the sugars,
Yeah,
they use it to hide that disgusting taste, that foul taste. So
exactly.
the stuff that we're being told that is good for us. I mean, it's absolutely mind blowing why people don't look into, well, why, hold on, if this is available in nature, if you pick up a apple from an apple tree, or say beetroots, oh my goodness, I mean, beetroots don't have too much of it because it's got sugar actually, but beetroots, it is so incredibly fibrous and sweet when you pick it organic and natural and it's
Yeah.
relatively freshly picked. Carrots, when you pick those, the aroma from carrots is absolutely awe-inspiring. But within a day or two of having been picked, the smell's gone because none of the carrots you ever buy in the shops actually have that aroma. You won't get it. So the point is this: you don't have to have your own garden or anything, but nature already provides all the medicines you ever need. So, is there any final comment or question you have? Well, comment really, because I'm the one asking questions today. Is there any final comment you have regarding, and maybe perhaps give hope to people with issues with conceiving? Who is there anything you want to say to them?
Yes, absolutely. So this is just tip of the iceberg. We are just exploring, and we will revisit this topic again from a different angle. There are so many issues related to why fertility gets affected, right? So we will come back to that. But one main thing that I want to say to people, anybody who's listening, is that there is so much you can do with natural medicine, natural herbs, natural therapies, breathing exercises, and lifestyle changes that you can make, and dietary changes that you can make. That you can almost 90% of medicine is within that. And then, in addition, if you need to take something else, you can always take that. So keep natural medicine with you. Doesn't matter what else you are taking, you can still take natural medicine. And there are no side effects, right? So that's a really big one for me because women's medications are all hormonal and there are so many side effects. Even years down the line, there will be side effects of those. So keep natural medicine with you. Natural medicine doesn't mean that you can do it on your own. Natural medicine means go and see a practitioner who can prescribe herbal medicines for you. And yes, there is huge hope for women who think this is the dead end. What else to do? Doctor has said they can't do anything because they don't know more than their medicines. So there is huge hope out there.
Brilliant. Okay, well, I mean, just one final comment, which is, which is inspiring what you've just said, which is this: that if your body, as a woman conceiving the child, if your body is healthy, happy, guess what kind of baby you're going to have when you do give birth. Thank you for watching, everyone. Dr. Ashish, great to see you again. Speak to you all
Thank
soon.
you.
Bye for now.
Bye.